Joining today's educational webinar with Cancer Support Community Los Angeles. I'm Abby Espinoza, the Program Manager at CSCLA, and I'm honored to welcome you to this week's webinar titled Survivorship After Cancer, What's Next? Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer, including patients, caregivers, and their loved ones, all at no cost. Our programs include support groups, healthy lifestyle classes, social activities, and educational programs such as this one. If you would like to learn more about our services or watch past webinars, please visit our website at cancersupportla.org. Before I introduce today's speaker, please note that your video and microphone are automatically disabled for this webinar. Please enter questions for the speaker into the Q&A feature found at the bottom of the Zoom window. Questions will be answered at the end of the presentation. We may not be able to get to all your questions today, but we'll get to as many as possible. Please use the chat feature to share comments and resources with other participants or to ask questions of CSCLA. We ask you to limit chat comments to information relevant to this topic. Dr. Priya Mitra started her career in internal medicine and then transitioned to radiation oncology in 2007. She currently works at UCI Medical Center and treats all cancers with a specialized focus in women's cancers. It gives me great pleasure to welcome today's speaker, Dr. Priya Mitra.
Hi, thank you, Abby, for that very warm welcome, and thank you all for joining. I really appreciate it. I'm going to share my screen. So as I was introduced, my name is Priya Mitra, and the topic for today is survivorship after cancer. Now what? So just an overview of what I plan to cover today is listed here. I'll give you a little bit of introduction about myself, some background, and then we'll talk about really three main categories. One is just general survivorship principles. Next, we'll talk about preventative health. And then third, we'll talk about mental health. And then we'll open it up for Q&A. Please feel free to message in the chat box if you have any questions. Happy to take questions, and I'll pause after each section just in case there's any real-time questions that come up, but we'll definitely have plenty of time at the end for questions. I know some of you need to leave a little early too, so again, if you have questions, please message in the group. Okay, so just a little bit of background about myself. My name is Priya. I have a background initially in internal medicine, so I worked at Boston Medical Center for a few years, taking care of hospitalized patients primarily, so heart attacks, pneumonias, diabetes, those kinds of things, congestive heart failure, which was a really great foundation. And after that, I decided to subspecialize in radiation oncology. I trained at Virginia Commonwealth University in Richmond, Virginia, graduated there in 2011, and then I worked in Philadelphia for about 10 years. I was at USC for a few years, and I'm currently at UCI. So let's start with just some general survivorship principles. And I guess before I do, I just want to give you a little bit of background. You know, I've been taking care of cancer patients for a long time now, about 15, 20 years. And what's been the biggest joy, honestly, is that more and more patients are surviving their cancer and going back to their normal lives as best as possible. So we have developed guidelines in our field for survivors because there's more of them, and we want to maintain and restore as much quality of life and normalcy as possible. So what exactly is survivorship? So I have several pictures on these slides that are from our NCCN guidelines. In case you're not familiar, it stands for National Comprehensive Cancer Network. So these guidelines are updated regularly. These were last updated about a year ago. And so how do they define survivorship? So survivorship, an individual is considered a cancer survivor from their diagnosis through the balance of life. This includes survivors living with cancer and those free of cancer. The panel that put these guidelines together recognizes that not all people identify with the term survivor, but this is meant to basically cover guidelines, or it's created guidelines for those who have had cancer in the past and have been deemed to be cancer-free. And basically the purpose of these guidelines, which will kind of be our guiding light through this presentation today, is to talk about the potential impact on the physical and mental states, health behaviors, professional and personal identity, as well as sexuality and financial standing. All of that can be affected by cancer, whether it's the diagnosis, the treatment, recovery process. So we'll talk about kind of how to navigate that. And just as a quick aside, if you're interested in the NCCN guidelines, you can create, I have a free account myself. Even as a patient, you can create a free account. It's a great wealth of information and great guidelines to reference, including this. So the objectives of survivorship care in our world are to really address these 5 components. Number 1 is surveillance. That's first and foremost, right? We want to make sure that whatever cancer a person had stays in control and does not recur. So that could include doing physical exams and doing scans as well. Number 2 is screening for new cancer. Sometimes if a person has developed a cancer, they may be high risk for developing another cancer. A classic example of that is like a head and neck cancer, right? Or like a throat cancer. Somebody who's, let's say, a heavy smoker or heavy drinker develops a throat cancer, they're maybe at high risk for developing a lung cancer. So they may benefit from screening for lung cancer by doing a CT of the chest. Number 3 is preventing and detecting late effects of the cancer and prior treatment. And that typically comes up in follow-up appointments. Number 4 is coordinating care with primary care physicians and other specialists. I love following my patients after I have treated them and they've been deemed cancer-free. Sometimes though patients transition back to their primary care clinic, and so that is a really good opportunity for us to coordinate care. I've had primary care physicians reach out to me and say, hey, is this normal? Should I send them back to see you? We also at UCI, and I think a lot of institutions have developed a survivorship clinic, which is a really nice asset to have for patients so that they can go and have somebody who's really focused and geared at all of these objectives. And number 5 objective of survivorship care is really promoting healthy lifestyle habits. And we'll go through some of these more in detail as we go through this talk. So again, according to the guidelines, the assessment that's recommended is at least once a year. All survivors should be seen by a healthcare provider. Now, who you choose to see for follow-up can be as simple as just your primary care doctor, or it could be the specialist who treated you, or it could be all the specialists that treated you. And I think the key is if you're seeing a lot of providers to make sure that there's communication within them, within that group, which is why my preference and typical recommendation is to keep all of your providers within the same health system, if at all possible. But if not, don't let that stop you. Care providers, these are the things that we are assessing at regular intervals. So, current disease status, how functional is a person, what medications are they taking? Should they be seen by a pharmacist? Should they be seen by a holistic doctor? What are their other medical conditions? What was the cancer treatment that they had? How were they treated? Was it chemotherapy alone? Was it chemotherapy and radiation? Was there any surgery involved? What's the family history? If somebody's BRCA positive, maybe that's somebody that should be getting high level of screening for other things. And so you can see a list here of other concerns that often can come up. Okay, survivorship concerns. So again, kind of along the same lines, these are common things that when I meet with survivors that they bring up or that I bring up. Cardiac health. I actually talk about this quite a bit with my patients. Heart attacks and heart disease kills more people than cancer. So I really try my best to educate people on, having a normal blood pressure, heart rate, maintaining good heart health, because that is really, really can have a huge impact on your longevity and quality of life. In that category, also kind of extrapolating from that would be, risk of strokes as well. And so teaching and learning about those warning signs so you know when to call for help. Anxiety, depression, trauma, distress, effects on energy level, pain, sexual health, fertility, sleep disturbances, trying to get back to work, seeing how that, segues in with your recovery and survivorship journey. So how do we assess, as clinical providers, how do we assess the needs and concerns of survivors? So I know this is a very busy slide and I'm not going to go through each one, but I just wanted to share with you a snapshot so you could potentially focus on something that you may have as a concern for you or a loved one. So on the left here, I've highlighted survivorship concerns. This is basically the list that we just went through. And so this is a survivorship care survey. So some survivorship clinics will go through this questionnaire and, ask you to say yes or no to each of these questions. And as you can see, there's different questions for each category. And if you answer yes or no to certain questions, then it'll take you to specific guidelines. So for example, cardiac health, if you answered yes to any of these questions, you can click on this blue hyperlink and it'll take you to the guidelines, which is why I'm a big fan of these guidelines because you can really tailor it to your needs. So preventative health is what we'll talk about next. So I think it's really important to emphasize that we as a community, have a lot of ability to control our health. Obviously, there's a lot of things that are not in our control, but everything that's listed here, we can impact and have a positive impact by taking certain actions. So we'll go through some of these more in detail, but I just wanted to highlight, your activity level, we can control. Our nutrition, what we eat, what we drink, we can control. Sleep is a tough one, but there's things that we can do, and we'll address this a little bit later. There are things that we can do to help improve the quality of our sleep. Alcohol intake, tobacco use, we can control this as well. And if you can't control it or if you're having trouble, there's help out there. There are resources. Sun safety, being out in the sun can increase the risk of developing sun damage, including the risk of skin cancers, but there's measures that we can take. Weight management, seeing your primary care physician who can help with the health screening and stress management. Okay, so physical activity. So we'll start there. In the green box here, I've kind of highlighted what physical activity is recommended for cancer survivors. And truthfully, this is pretty much what's recommended for all people. The goal should be to aim for at least 150 minutes of weekly activity with the ultimate goal of 300 minutes or more of moderate intense activity. And I'll show you some examples on the next slide. When I first read 150 minutes, I remember thinking that just seems unmanageable. That seems too much. If you break it down though, it's typically 30 minutes, 5 days a week. That's the goal. Now, again, a lot of these guidelines that I'm going to show you and recommendations are not hard and fast rules. They're just goals. So I don't want you to leave this feeling discouraged. I want these, hopefully you can identify something in here that you could strive for and aim for. So these are just ideal goals. So, at least 150 minutes of weekly activity, engaging in 2 or 3 sessions per week of strength or resistance training, including the major muscle groups, incorporating stretching, and trying to incorporate core exercises and balance training, especially for older survivors because they're at risk for falls. And the older a patient is, and the higher the risk of falls, the higher the risk of breaking something and then impacting your normal function, which is what we want to avoid. So remember we talked about here, the goal is moderate intense activity of 150 minutes. So here in the middle is a category of examples of physical activity. So we've got light exercise, moderate, which is what we're striving for, and vigorous. So light exercise is pretty basic stuff, going for a slow walk, a leisurely bike ride, taking care of your kids, bowling, a video game at home if you're, doing some sort of activity associated with it, light housework. These are all light exercises. You're not going to have a noticeable change in your breathing pattern. Moderate exercise, yes, you can talk, but you can't sing. So it requires more effort. So you can see a lot of examples here. So moderate intensity yoga, pickleball, Pilates, going for a brisk walk. I think this is really a good one to emphasize. I think brisk walking is thought to not represent an adequate type of exercise, but it really is. If you're walking briskly, that is sufficient to meet these criteria. Playing doubles tennis, even gardening can be moderate exercise. Vigorous exercise, you can see examples here. These are a little bit more intense. So running, playing, doing martial arts, jumping rope, jogging, high intensity yoga, boxing, aerobics, these kinds of things, swimming laps, climbing stairs, singles tennis as opposed to doubles tennis. So again, just going back to highlight these. So again, the goal would be at least 30 minutes a day for 5 days a week. Or you can do 75 minutes of vigorous, intense activity spread out over the course of the week. So again, going back to the vigorous exercise, if you go to a boxing class, 2 30-minute boxing classes or 2 45-minute boxing classes a week, or you play singles tennis one day and you play pickleball another day, you can really get into vigorous exercise and be meeting these criteria or these recommendations. Resistance training. So the recommended frequency is typically 2 to 3 times per week with adequate rest in between sessions. Intensity, trying to do 2 to 3 sets of 10 to 15 reps per set. It's really helpful to often work with a trainer if that's feasible. It's something that's available in local gyms, the YMCA, Planet Fitness. There's lots of gyms that offer this, or you can always pursue the personal training approach. So again, this is just kind of a broadly one to highlight what's in orange. These guidelines we've just talked about for physical activity are not going to work for everybody. And honestly, you may have weeks where it works and there's weeks that it doesn't work, and that's okay. These are just goals. But if you are someone or a loved one has established lymphedema, you may need to get assistance with, going to physical therapy or going to a lymphedema clinic. If somebody has an ostomy, that may require some modification of what type of exercises that they're doing. If somebody has a limb prosthesis or has had a limb amputation, same thing, adjusting. Peripheral neuropathy is a common side effect of many chemotherapies, which could then potentially shift the focus to doing more balance training, right? Because somebody who has peripheral neuropathy may struggle with balance. And so trying to build that muscle and those balance muscles will be very, very helpful. If you've got bone loss or bone metastases, also trying to minimize your fall risk. And then just, incorporating core as well, as we talked about. So here are some strategies that we can all use to increase physical activity. One is going to an exercise specialist, whether it's a trainer, joining a class. That's been really helpful for me, honestly. For example, I love doing yoga, and so going to a class forces me to do it. I tend to get lazy if I'm just doing it at home. Having a buddy too, having a social support, exercise buddy, whether it's a friend or family member. You don't have to necessarily work out together, but even if you have a friend in a different state or a different city, you hold each other accountable. Wearing a fitness tracker to monitor your steps, trying to aim for a goal of 7,000 to 10,000 steps per day, and setting SMART goals. I want to shift to this on the next slides. I'm not sure if you're familiar with the SMART goals, but it stands for specific, measurable, achievable, realistic, time-bound, short and long-term goals. So we'll go through some examples here. So a SMART goal, again, is something specific. You could easily, a lot of times this happens around New Year's, right? We all make resolutions at times and say, I want to lose 10 pounds. That does not really meet these recommendations. So be specific, make your goal specific and narrow it down for more effective planning. Make it measurable. Give yourself 3 pounds in a month or 2 months. Make it something that's achievable. To lose 10 pounds in 1 month is not really a realistic thing. And your goal should be aligned with your values and long-term objectives. Time-based, setting a time date. Like, for example, I want at the end of 3 weeks to reach this level of fitness, for example. So here's some examples. So in the category of fitness, I will walk for 20 minutes on my lunch break 3 days a week for the next month to improve my stamina. Health, I will try and get an extra hour of sleep every night by going to bed 15 minutes earlier each week for the next month. Learning, I will take on a 4-week online project course to enhance my career skills. Relationships, this is really important, having social connections. I will call at least one family member every Friday to strengthen our bond. I will mail a card. I will send an email. I will send a text every Monday to my loved ones. Just say I'm thinking of them. So again, and the nice thing about these goals is if you have a time frame, like let's say here for the next month, you can reassess then and you can modify your goals at the end of that month for the following month. Okay, so next we'll shift gears to nutrition. So I love the phrase eat the rainbow because the key is trying to incorporate all colors of the rainbow to promote a healthy lifestyle. And what does that mean? That doesn't mean Skittles. That means, red like strawberries, red bell peppers, oranges, lemons, bananas, spinach, blueberries, raspberries, blackberries, eggplant. Just try to get in colors of the rainbow when you're going grocery shopping. This is an example of what a healthy plate would look like. So maybe a quarter of protein, half the plate is fruits and vegetables, and then some grains and a little bit of dairy. So it's again 30% vegetables, 20% fruit, whole grains about 30%, and 20% is protein. So on the nutritional front, the recommended sources of dietary components are listed here. It's important to get a little bit of fat, carbohydrates, and protein. And so, just trying to strive for finding that balance, incorporating avocados and seeds and nuts, which have a lot of fiber in them, can be very, very helpful. Nutritional goals, predominantly plant-based diet is what's typically recommended, including vegetables, fruits, beans, and whole grains. You want to monitor your portion sizes and caloric intake. There's actually been studies that have shown that the more people that you dine with or eat with, the bigger your portion sizes tend to be. Eating is a very much a socializing event, and so monitoring your portion sizes can be really important, especially when you're in a group setting. And be cautious with intermittent fasting. I think this is something that's become very popular. I think it works for some people, but you have to be careful. Some people, it can trigger dizziness, lightheadedness, dehydration. So please speak with your provider about that if that's something that you are interested in. Next is limiting the following. So red meat and processed meats have been linked to cancers. So we certainly want to limit our intake of that as much as we can. Chips, cookies, candy bars, sugary cereals, fried foods, baked goods. These are all good things. I definitely enjoy eating a lot of those things as well. But monitoring the quantity is really helpful. I found this to be interesting. So refined sugars, the recommendation is to have less than 25 grams for a 2,000 calorie daily diet. And so basically, if you had a 12-ounce can of soda or pop, that already by itself exceeds what's recommended on a daily basis. I wanted to just briefly touch on the blue zones. I don't know how many of you are familiar with this, but I find this to be really fascinating. Blue zones are basically parts of the world where they have the highest concentration of people living above the age of 100. And the interesting thing is that if you look at where they are, they're really all over the world. You've got Japan, Greece, Italy, Costa Rica, and Loma Linda here in Southern California. All very different cultures, but if you look on the left, and I'll let you read here, basically there are 9 common features of all of these people in these concentrated blue zones. And I wanted to highlight a few of them. Move naturally. We just spent some time talking about physical activity. It doesn't necessarily have to be a class. Again, going for a walk, taking the stairs, just incorporating activity, in little bits, parking away from the grocery store, parking far in the parking lot, having a purpose, a reason for living each day. 80% rule, stop eating when your stomach is 80% full, which helps limit portion sizes and caloric intake as well. Plant slant, we kind of talked about that, having plant-based meals. If you're kind of curious about this, you could do, I know it became popular for a time, there was meatless Mondays. I, for example, don't eat meat on 2 days a week, and every Monday, every Tuesday, it's just a way to help limit my meat intake. A little bit of alcohol is okay, just moderate. And regular consumption of alcohol was actually a common feature. Loved ones, establishing a community, belonging to the right tribe, having those social circles. So if you're curious about it, I would definitely look into this. There's definitely talks on YouTube about it, and there's books about it. There's a TED Talk about it, but it's pretty fascinating. So on the topic of alcohol, the goal would be to drink sparingly if possible. Normal intake in one setting or one sitting is 1 drink or less for a female and 2 drinks or less for men. The definition of binge drinking is quite probably different than what many of you would guess. So 4 or more drinks in one sitting as a female is considered to be binge drinking. And 5 or more drinks in one sitting is considered to be binge drinking for men. If you have a history of any of these cancers, the strict recommendation would be to really avoid alcohol if at all possible. But if you're going to, then it's certainly fine to have a drink here or there, but just to be careful of quantity. Next, want to shift to weight management. I don't know if you guys are familiar with BMI or body mass index. This is a great tool that can give you a ballpark idea of kind of where you fall into the category of underweight, normal weight, overweight, and obesity. So if you Google this, you can look up a BMI calculator, you enter your height in feet and inches, you enter your weight, and it'll calculate your BMI. And there's a range, and this is not a perfect calculator, but it gives you a ballpark idea. Nobody should, for example, really have a BMI of 40, right? That's an extreme. That definitely is a worrisome thing. Nobody should really have a BMI of 10. That's also an extreme. So it can give you an idea, and just as a starting point. and this is the goal range. There's a three-prong approach if you want to work on weight management. One is caloric intake or portion control. Two is physical activity, which we've talked about. Three is behavior changes. What time of day are you eating? What are your food choices? Are you exercising? And I should add on here for fourth one, which is medication, right? I mean, there are definitely people who have tried the traditional methods and require medication. So if that's something you're interested in, please talk to your healthcare provider about that. Sun safety. So the use of daily sunscreen is really recommended. It helps protect against UVA and UVB rays, minimum SPF of 30. Reapplying sunscreen every 2 hours if you're out in the sun, especially if you're sweating. The goal would be to avoid tanning beds and to wear protective clothing if you're going to be outside for a long period of time or wearing a hat. Sleep. These are the guidelines for how much sleep the typical person should get. So for adults, the goal is 7 to 9 hours. I think we all know people who need more or those who need less. But this is for the average person, about 7 to 9 hours. Adolescents actually typically need more, 8 to 10 hours. Older adults can sometimes get away with a little bit less. Sleep hygiene, I think, is an important concept to be aware of if you're not. If you're having difficulty with sleep, these are some helpful tips that can be utilized to help improve your quality of sleep. So maintaining a regular bedtime and wake time every day is very, very helpful. Engaging in regular physical activity. You want to really try and avoid strenuous or heavy physical activity about within 3 hours of bedtime, because sometimes it takes some time for your body to kind of wind down. Exposure to daytime bright light in the morning is really a nice thing. Minimizing screen time at night. This says within a few hours, I think, at least I would say 30 to 60 minutes if you can. Reading before bed or just listening to music, just trying to minimize how much stimulation you're giving your eyes and your brain. Trying not to eat too close to bedtime, avoiding alcohol and nicotine too close to bedtime. Same thing with caffeine. Try and have at least 4 hours before bedtime where you have no caffeine. You can make your sleep environment more conducive to sleep. So, darkening it, making it quiet, adjusting the temperature. Trying not to look at the clock when you wake up at night. That is something that I have had to battle, because I know that I've noticed that if I look at the clock, then it's harder for me to fall back asleep. Trying to limit your nap time. If you do take a nap, try and do it no longer than 30 minutes. And turn off any electronics or light emitting sources at bedtime or sound emitting sources. So sleep hygiene, if you try those measures and it doesn't work, there's other tools that can be used to help. So you can see here, trying to do visualization, yoga, meditation, deep breathing, just trying to really create your bedroom environment to really just be a space for sleep and sexual activity, trying not to have a TV in your room, those kinds of things. Or if you do have a TV in your room to, turn it off at a certain time before you go to sleep. Shifting gears to sexual health. So sexual health can definitely be impacted by in survivors. So this is a questionnaire that we sometimes use to ask patients on, are they having any difficulties with any of these issues? If you have a provider, if this is a concern of yours and your provider is not asking you, you can certainly bring something like this to them, to their attention, or please do bring it up. I think a lot of patients shy away from bringing up these concerns, but it is really important, and there's things that can be done to help improve all of these. And again, this is just this is a sexual health inventory. It's called the SHIM score that everybody that I've treated for prostate cancer, we usually give this as a questionnaire just to kind of gauge their level of sexual health and functioning, and see what we can do to help with that. Next, going to move on to mental health. So depression is something that definitely impacts people in general, especially survivors. So I wanted to just highlight the definitions of depression and anxiety in this forum. So just as a screening, so if for over 2 weeks, more than half the time, if you have at least 5 of the following, you really, it doesn't mean that you definitely have depression, but you may. So, feeling depressed, sad, empty, losing interest or pleasure in activities, sleep disturbance, weight loss or gain, lack of energy, feeling worthless or excessive guilt, thoughts of hurting yourself, or decreased concentration or indecisiveness. So, as you're reading this, if this is something that's ringing alarm bells for you, please do reach out. There's plenty of resources, and I'll share some places that you can reach out to. Anxiety, having excessive anxiety or worry that is difficult to control, and at least three of the following. So if you're feeling restless or on edge, feeling really easily fatigued, having difficulty concentrating, feeling irritable, muscle tension, sleep disturbance, again, just because you meet some of these criteria, I mean, I feel like some of these symptoms go along with PMS or perimenopause. So, again, not a guarantee, but just maybe a sign that you need to discuss it with someone, especially if you think that you might be more anxious than the average person. Panic is something a little bit different, though. It's a sudden, intense fear or discomfort that peaks within minutes. Typically, patients with panic disorder have at least four of the following. So trembling or shaking, like a panic attack, palpitations, feel like your heart's racing, chest pain, discomfort, fear of dying, paresthesia, you feel like you get numbness or tingling in your fingers, fear of losing control. Feeling of unreality or being detached from yourself, feeling dizzy, lightheaded, unsteady. So if you meet the criteria on the prior slides for any of these, please reach out to speak with a healthcare professional. You can call or text 988, or you can visit their website, 988lifeline.org. It's a suicide and crisis lifeline. You can call, text, chat. Please, you are not alone, so please do reach out. So in conclusion, just wanted to summarize that, survivorship is really the beginning of regaining your life back in a new way. And yes, it's important to keep up with the recommended follow-up visits and tests, which your providers will be sharing with you. But I think it's important to just, emphasize that there are lots of ways that you can maintain a healthy lifestyle and help decrease the risk of recurrence and the risk of developing another malignancy or other health issues. And factors that are important to that are nutrition, physical activity, weight management, and some of the other things that we talked about. And also making sure to prioritize mental health and sexual health, and don't be shy about reaching out to your healthcare provider to ask about those things. Finally, I just wanted to end with some resources, and this is recorded, and I'm happy to share my slides for future reference if anybody would like. But basically, I've got several slides here that have links for where you can reach out to. So for example, if you're concerned, if you want to get involved in the Leukemia and Lymphoma Society Survivorship, they have a whole section just dedicated to that. The CDC as well, American College of Lifestyle Medicine, Hodgkin's has an international group that really is geared towards survivors. And then here's just a whole list of other survivorship guidelines, integrative therapies. We at UCI even have an integrative medicine department, which a lot of patients have really loved. They talk about dietary supplements, things that you can incorporate into your life as a survivor, legal and employment issues. So lots of resources here. Americans with Disabilities Act. There's a whole Cancer Legal Resource Center. So there's just a lot of tools out there. Employment rights, if you're struggling with, as a survivor, if you're struggling with your employer, how can you help navigate that? Health insurance issues. This is information about LGBTQ individuals with cancer. There's a whole list of organizations that help with that. Menopause and sexual health, Menopause Society, the ACOG, physical activity, if you want to get more information about that. The YMCA has several programs. There's Live Strong, there's Silver Sneakers, which I am a huge fan of. I've had lots of patients participate in that. So, if you're of the mindset if you want to try and get stronger and incorporate more physical activity, you don't know where to start, you can reach out to these programs and find a exercise buddy, or find a partner or class or program that you can get involved with. Here's also just resources for nutrition and weight management. If you're not sure, if you feel like you've tried everything and you want to get some additional guidance and support, these are resources you can reach out to. Cardiovascular health, heart disease and stroke prevention tools. So you can learn about that if you know that you're at high risk for developing heart disease or stroke, whether it's family history, obesity, high blood pressure, high cholesterol, diabetes. Oral and dental health. This is a really can be a serious issues in patients who have mouth cancers or throat cancers. So maintaining oral and dental health is really helpful as well. And this is the last slide of resources. So, sleep disorders. If you've tried sleep hygiene and it's not working, maybe you need sleep testing. Maybe there's a sleep disorder that you've developed. Smoking cessation, ways that you can help cut down on that. And then we've talked about the mental health stuff. So suicide and crisis Lifeline, we talked about if you're a veteran or if your loved one is a veteran, they have special programs as well. There's mobile apps here too that you can access. So with that, I want to thank you all very much for your attention, and I'll open it up if there's any questions. Let's see what we have. What is your opinion on estradiol for breast cancer survivors? That's a great question and a complicated question. There's different types of estrogen supplements. There are creams, there are tablets, there's bioidentical, there's a wide range. And truthfully, that's not something that I prescribe. So what I would recommend is that you meet with a specialist, ideally an OBGYN or a gynecologist who has expertise in that area to talk about your options.
Thank you so much, Dr. Mitra, for your very informative presentation. We did receive a question in the Q&A. I don't know if you can
Oh,
see it.
I'm just seeing that now.
Okay.
How do I get my doctors to take my history of cancer and chemo into account when they assess me? This person had lymphoma and chemo in 2024, had a negative effect on her hormones. Everyone keeps saying it's just menopause. And then they say it's perimenopause. That sounds very, very frustrating. I'm sorry you're having to deal with this. I mean, the first thing that comes to mind, truthfully, is if you're not satisfied with your providers, I would get a second opinion. I'm a big fan of getting a second opinion because if you feel like your concerns are not being addressed, I think it's worthy of asking another provider. Because it sounds like, if I'm understanding your question appropriately, that you're trying to voice your concerns, and it sounds like it's not landing well, and you're feeling frustrated. So I would get a second opinion. A lot of times I think people shy away from getting second opinions, partly because of financial reasons, but truthfully, insurance companies will often cover it. I've encountered this quite a bit where a patient will come to me for a second opinion, and they may get denied, but I can make a call we can set up a call with the insurance company and we fight on your behalf to make it happen. And I think that's what I would do as a starting point. If you're another option, if you don't want to go elsewhere, is like, let's say you're in a practice where there's 3 primary care doctors, you could ask to get an opinion from another doctor in the same practice, whether it's your general practitioner or your OBGYN. But I think that's where I would start, and I hope that helps. Hope that helps answer your concerns and question. Another question, I will complete immunotherapy for kidney cancer. Do I need a referral to a nephrologist to keep the remaining kidney healthy? I think it depends a little bit. Let's see. I think it depends a little bit on if I'm curious, like, I don't know if you are already following a nephrologist. The referral piece really, honestly, typically boils down to your insurance. Some insurance require a referral, some don't. So I guess that's what I would ask. And I'm also curious what your kidney function is. But I think it's very reasonable for somebody with a history of kidney cancer. If it was me, I would want to be seen by a nephrologist at least once, just to kind of get their input. So yeah, I would definitely talk to your oncologist or primary care, whoever's handling your immunotherapy. I would certainly ask for a referral.
Thank you so much. If anybody else has any questions, you can feel free to put them in the Q&A. We did receive some questions during registration, so I can go ahead and move on to those.
Okay. Honestly, I'm open and you can ask any questions. It doesn't have to be on this topic either of survivorship. If you have just general questions about oncology and I do radiation, but I have some general knowledge about just cancer treatment, obviously. So feel free. I will do my best to answer them.
Thank you so much. So first question, is tiredness or lack of energy a common long-term or permanent state years after treatment?
It depends on a lot of variables. I mean, the short answer is yes, it's possible. There's so many factors though, right? I mean, it depends on what are your other medical conditions, what was your diagnosis, what type of cancer was it, what type of treatment did you receive? How long did that treatment go on? Are you still receiving that treatment? So it's hard for me to answer that question without further details, but the short answer is yes. But like I can give you an example, like if I treat a patient with breast cancer, um, or cervical cancer, like a gynecologic cancer, what typically happens after radiation is they experience fatigue. It typically peaks 1 to 2 weeks after, and then it subsides. So that's why, and if somebody came to me with that um, history and they were telling me they were having profound fatigue, then I would probably want to investigate other sources. For example, thyroid, are you anemic? Are you deficient in B12? Are you deficient in other things that could be contributing to your fatigue?
Thank you. Another question that we received was, how does one recover from chronic fatigue and urinary incontinence issues post-radiation treatments?
Chronic fatigue and urinary incontinence after what you said?
Post-radiation treatment.
Yeah, so with for the urinary incontinence, what I typically recommend is to be seen by a specialist. There's two specialists that I would consider. One is a urologist. They can sometimes either do procedures, prescribe medications to help with that. Alternatively, another specialist that I think is kind of underseen or not really maybe as well publicized is a urogynecologist. So a urogynecologist is typically somebody who's done an OBGYN specialty, residency or training, and then they subspecialize in urologic issues in gynecology. So basically, primarily, it's like almost like a female urologist. So you can get a referral for that specialist either from your primary care doctor or your urologist. But yeah, in terms of urinary incontinence, there are things that you can do. There's the pessary, there's exercises you can do, there's Kegel, like the Kegel exercises. You can also go to pelvic floor rehab. That's another resource that I've sent a lot of patients to. We have that here, I know at UCI, and I'm sure most big hospital systems have that, so that's something also to consider. In terms of chronic fatigue, there's a lot of different possible causes for chronic fatigue. Could it be depression? Could it be anxiety? Could it be residual side effects from your treatment? Could it be that you have a new diagnosis? Could it be that you're diabetic? Could it be that your blood pressure is running too low? Could it be that your blood pressure is running too high? There's just a lot of things. Or honestly, maybe it could be something as simple as you're not eating well, right? If you're not eating well, you're not getting enough physical activity. There's so many things that can contribute, which is why I would encourage you to talk to your preferred provider, ideally either your oncologist or your general practitioner or primary care doctor, to see if they can investigate causes for chronic fatigue, because that's not something you want to live with. That kind of has a negative impact on quality of life. So yeah, that's what I would suggest. I hope that helps.
Thank you.
I see another question here in the Q&A box. Is there any special diet since I didn't receive chemo or radiation, type 1 breast cancer? So the diet recommendations that I shared with you guys today are honestly just general recommendations. It's something that I even try and follow myself. So, I usually tell my patients just follow a general healthy diet, right? Making sure half your plate is fruits and vegetables as best as you can, minimizing your red meat, doing a plant-based diet. I mean, it's been shown to be equated to longevity, right? Or there's a direct link of that. And so I would follow. That's why I wanted to share those guidelines and share about the blue zones. That's what I would recommend. If you have more specific questions about diet, I would talk to a dietitian or a nutritionist. Most oncology divisions or departments have a dietitian on staff, and that can be a really great resource. Especially if you have questions about supplements, I would ask about an integrative health specialist. And again, as I mentioned, we have that at UCI, which I'm grateful for. Okay, we have another question here. As a 48-year-old, very physical woman, I lift weights and understand protein intake is important. How do you feel about creatine? Great question. I honestly don't know enough about creatine. So it's a question I have myself. So I really don't know what the right answer is for that. So this is where I would also just, speak to a specialist. I would speak to not only a trainer, somebody in the exercise space, but I would also speak to a healthcare provider too. The other thing to think about is just making sure your other blood work is okay. You you don't want that to have a negative impact on, for example, your kidney function or other blood tests. So that's why I would counsel um, a healthcare provider before adding that supplement. And if you don't feel comfortable with that, then I would talk to, honestly, Integrative Health. I think they're kind of a nice in between of their healthcare provider, but they have a lot more knowledge about these types of, supplements and things like that.
Thank you so much. We still do have another few questions from registration, so I'll go back to those. Again,
Sure.
if you have any other questions, please feel free to put them in the Q&A. Um, Another question we received was, are there any supplements that are recommended for survivors?
So I think it depends on it's hard to give a general recommendation that all survivors should take the following supplements. Because some supplements are better than, for certain people than others. So that's why, honestly, I've become a big fan of the integrative health. So that's where I would reach out to ask about supplements because certain supplements are great for some people and not for others, right? Like, for example, I have had many people come in on B12 supplements and I'm like, well, have you had your B12 levels checked? And they're like, no, I just thought it was good for me to take. And, you can develop B12 toxicity. So, same thing with iron supplements. I've had patients who come in on iron supplements. I had one person, a gentleman I was taking care of who had prostate cancer, and he brought in all the supplements. He went to like, I think a GNC. And when I was looking at the ingredients, one of them had testosterone in it, which we actually think contributed to him developing prostate cancer. So you just have to be really careful. I'm not anti-supplement, but I just want you to be cautious about what supplements you put into your body. Even a multivitamin, right? Not everybody needs a multivitamin, so just please talk to your healthcare providers, and so they can give you tailored recommendations to you.
Another question we received, and this is coming from a caregiver slash loved one's perspective, but how can we best support cancer survivors? I know it's kind of general, but do you have any recommendations?
So I think I would go back to the beginning of this presentation, kind of talking like identify who you're caring for, what are their needs, right? What category can you help them the most? Is it sleep? Is it nutrition? Is it physical activity? For example, if the person you're caring for is, not, is physically able to move, but is very sluggish, that's a simple way you can say, let's go for a little walk. Let's get some fresh air. If you feel like they're having trouble sleeping, you can try sleep hygiene. If you feel like, their blood sugars are all over the place, let's try and, modify our diet. Let's cut out that can of soda. And if you can't cut out a can, cut down half a can. So I think I would go to those categories if the different categories of how we can help and kind of go through. Honestly, I would do that assessment, the questionnaire that I showed, and see if the person you're caring for would answer yes to any of them, and then you can use that as a guide to hopefully help you identify ways to help support that person. Is there anything else you can recommend for a sleep aid? I can fall asleep, but wake up several times a night and have difficulty falling back asleep. What are your thoughts on ZzzQuil CBD gummies? So I think I am a fan of trying sleep hygiene as a starting point. So, minimizing devices before bed, just going to bed and getting up at the same time, taking a hot bath or shower before going to bed, not eating or drinking too much right before going to bed. If you're trying those things, that's what I would start with, truthfully. Doing meditation, that helps me a lot. Just doing a meditation, sometimes if I can't fall asleep, it just helps me actually sleep deeper. I think medications are okay. I don't think it's a great long-term solution. So, I like if I've used Benadryl periodically, but I really try not to do it too often. Melatonin is another one that's at least like somewhat natural and over the counter. But again, I think if you're reaching the point where you regularly need medications, I would talk to your healthcare provider. Maybe you need prescription strength medication, but maybe worth investigating and trying to better understand if there's a cause. There may not be a cause, but is there possibly a cause that's keeping you up at night? Is it bright screens? Is it noises? Are there things that you can do to potentially help mitigate that? Physical activity is a big one, I think. I notice that when I exercise, I sleep better. So that's something also you could try.
Thank you.
Hmm.
And then we have one time for one more question. Um,
Oh wait, we have a follow-up. She's tried all those on it. Then you know what I would do? I would probably I would see a sleep specialist. You can go see there is a there's a specialist that sleep medicine. That's what I would do. They can help I think manage things. Hope yeah, good luck. I hope it helps.
Thank you. And then we do have time for one last question. Someone said, how do I stay positive after treatment, specifically when it comes to having anxiety about recurrence?
That's the $1 million question, honestly, right? I mean, that's kind of my point and hope. My hope for today was that you leave feeling a bit empowered that you have control over, obviously not everything, but you have control over a lot, right? And so I think it gives myself included, it gives all of us, I think, some peace of mind to know we're doing everything we can to control what we can, um, and to celebrate. Like really, each day is a gift, right? Saying thank you every morning when you wake up, gratitude, journaling, being exposed to nature, just really reminding yourself. Honestly, volunteering too. I've had a lot of patients who, as you know, they transition to survivorhood, they start volunteering at the hospital, and that really gives them purpose. And it kind of ties back to the blue zones too, right? One of the 9 common features was having a purpose. And so if you find yourself feeling anxious or nervous, first off, that's a very normal sentiment and feeling. And you know, don't be hard on yourself for feeling that way. But I think it's finding ways to offset that with gratitude and service and community, right? I mean, you as a survivor have a lot to offer to those going through the journey, right? Who are following in your footsteps. So, you know, attending support groups. I used to help moderate support groups like breast cancer survivor groups. And I loved seeing the survivors in that group, in that forum, because they just provide so much wisdom and support and strength. And, you know, you could volunteer for the American Cancer Society. You could, they need drivers. This is something I'm so grateful for. I have a lot of patients who cannot get to and from daily radiation treatment. And, you know, it's the volunteers at the American Cancer Society or even at CSCLA, you know, that really help make the journey better for other people. So maybe that might be a approach that you could pursue. But also meditation. I'm a big fan of meditation. I think that really helps bring calm to most people. And if it's not meditation, just going for a walk, getting outside, getting exposed to nature. Honestly, sometimes I do that even at work. Just go outside for about 5 minutes, even just get some fresh air and come back feeling recharged.
Perfect. Well, we have reached the end of our time together. Dr. Mitra, thank you once again. We truly appreciate you and you sharing your time with us and answering all of our questions. I do have a final closing slide that I will share. If you would like to learn more about Cancer Support Community Los Angeles, please visit our website at cancersupportla.org. And if you have any questions or would like more information about CSCLA, please email us at info@cancersupportla.org. I also wanted to share one of the support groups we offer. We do offer a post-treatment support group, and this meets the second and fourth Tuesday of every month from 5 to 6:30, and it does meet virtually. So again, if you want more information on how to get started with that group, please feel free to reach out to us. Um, Dr. Mitra, thank you once again. We really appreciate all of your time and thank you to our participants for being so engaged today.
No, I
We
really appreciate it. Thank you so much for the invitation and I appreciate you all joining and I hope you learned something and I wish you all the best.
thank you so much. We hope to see you all at a future webinar. Bye, everyone.